The pandemic hits and I'm unemployed. So what do? I do a lot of virtual consults. At the time she was living in Michigan and she was planning on moving back to New York once things cool down. So there's a lot going on here, and we're going to break it down as to why the width is narrow, why the smile is angled off, and why she has bonding that she no longer likes. So a lot of things going on in her smile. So let's get into it, and I'm going to show you everything. So as I mentioned, we have the 4 front teeth have bonding. So all of that tooth surface is bonded, partially because she had open spaces and gaps that the dentist wanted to close, which in the preparations, I will show you exactly how that looks. Also in that composite bonding, she is having some decay forming, some staining that she hasn't been able to get rid of. Obviously in her own natural teeth, she doesn't like many factors. One is color. Okay, you can see that there's this discrepancy in mineralization, yellowness, width of her smile. So she wants it to be more broad so the front 4 teeth don't just stick out. And also the disproportion in the gum height. So you can see right here, the gums need to be raised. And also, as I mentioned to you, her smile is basically not that even. It goes down and then this tooth angles this way, so then the whole smile slopes up this way. So there's a lot of things that are going to go involved here. There's going to be a little bit of gum tissue recontouring, there's going to be a removal of the old bonding, and then there's also going to be just straightforward, minimally prepared porcelain veneers reshaping. And so then we can see right here, I show you this angle is because this is the part where I'm going to laser the tissue in order to raise it so that it looks like it's uniform with the entire smile. So I'm going to show you on the next photo exactly what lasering the tissue looks like. It doesn't have to be a procedure where a lot of recovery time is involved. The tissue recontouring, I do it for a lot of my cases. So you'll see not only did I do the recontouring on these teeth, but I actually use the laser to peak the tissues over here so that it is nice and proportional with the rest of the smile. So what you're seeing here is veneer preparations on that side, and then I started creating the arch form, and in order to, before I move forward, I laser the tissue. So this is what it looks like when it's prepared. That's immediately what the tissue looks like upon preparation. These are the gaps that I was talking about. This is the bonding fully removed and the veneer preparation. So as I mentioned before, I'm going wider in the smile. So we're going to be creating width in her smile. So if we're doing width in her smile, then obviously we don't need to reshape much of the tooth. We just have to put that margin so that my ceramist can see exactly where to finish that preparation. And that goes on the case everywhere. And you can see right over here, this is where I laser the tissue. But I'm going to show you what the tissue looks like after I put in the veneers. So this is with the temporaries, just 2 days after. Do you see how healthy the tissue looks over here? Just 2 days after. But the really important part is how we corrected and addressed the canted smile. Remember how the slope of the teeth were going down like this and then up like this. So what was important to do here, even though the tissue heights aren't even and ideal everywhere, we know that I need to make the height of contour of the teeth to be quite proportional so that then from that, the angles of the teeth can be done correctly and built up correctly by my ceramist, following exactly what we do in the mouth. This is what the veneers look like on the model, and if you notice, if you can count, you'll see that there's an odd number here. Usually we do 6, 8, 10, 20, even numbers. But the reason we did an odd number is because her smile was wider on one side and she was missing a premolar that she had extracted while she had orthodontic treatment when she was younger. So what we're doing is we're creating the illusion that actually there is no teeth that are missing and that the width and the proportions of the entire smile is even, but kind of everything is skewed to one side. So since that's the case, I have to compensate with building up the one other side a bit more. I'm going to show you exactly what I mean by that. But in the meantime, take a look at all these natural characteristics. Our goals here are to make the teeth, her smile, basically undetectable from being porcelain veneer, just a super natural looking smile. these are all the veneers put in. This is how the tissue heals after lasering, not lasering here, lasering right here, lasering right here, and not lasering on these ones. But notice how these natural teeth are, how these porcelain veneers are looking so natural. And then this is what the teeth and the tissue looks after I always say everybody's different. About 90% of the tissue healing happens at the first 2 weeks, and then it takes anywhere from 6 to 9 months for the rest of the healing to take place. So this is a 2-year photo after, and you can see the tissue is perfectly healed and hugging the veneers like it was her own natural teeth. Remember, this is where we started, and so if I just go back real quick, you can see that's where we finished. And notice the difference in how I'm able to utilize the recontouring of the tissue to also create the flow of the teeth along her lips, moving all the way around from one side to the next. You can see here it's higher, then shorter, then flat across. And so these are all things that we're incorporating into the smile to give her a natural, beautiful, healthy smile that will last a long time, whether she's in New York or in Michigan.